I'm Margiad Williams. I'm the co-director for the Centre for Evidence-Based Early Intervention with Professor Judy Hutchings. And as I say, I'd like to just give a brief history of how KiVa came to Wales, because it's actually been around for quite a long time now, to talk about some of that early evidence of effectiveness, some of that research that we've done over the last, more than a decade really. And then I'm going to finish by just giving a brief description of our latest piece of work. It's almost our cumulative piece of work where all of our previous work has gotten us to this point. So it's our Stand Together trial. So I want to take you back, all the way back to 2011. So during this time, it was a legal requirement for all schools in England, in Wales, and in Northern Ireland to have some sort of policy in place for dealing with bullying incidences. However, this legal requirement was only, it was kind of guidance around some recommended strategies that schools may want to use in dealing with bullying. It was a very similar situation to what happened in Finland before the development of KiVa. So there wasn't really core kind of research evidence-based strategies that were being recommended to schools on how to deal with bullying. So in 2011, it just so happened that Professor Salmivali was here in the UK. She was giving a presentation at Cambridge University. And again, it just so happened that Professor Hutchings was in attendance at that meeting. And she heard about this programme called KiVa. We'd never heard about it before. And she immediately thought, we need this. We need this in Wales. We need it here in the UK. So she had a conversation with Christina about would it be possible, and they started talking about Christina coming over to do some training for us. At a similar time, the Welsh Government had started talking about school improvement objectives. And they had a meeting with the school improvement officers where Judy spoke, and Judy told them about, I've just come across this amazing anti-bullying programme from Finland, and I've been talking with the developer, and we're going to bring it over, and we're very excited about it. So she introduced the programme to the Welsh Government. In our discussions with Christina, earlier she mentioned a little bit about the KiVa programme. The programme has 3 different units of curriculum within the programme. The second unit, which is for ages 9 to 11, was the first unit to be translated into English, because this was the unit that had shown the strongest effects in Finland. So around this time, Unit 2 was available in English. The following year, the Welsh Government actually put together a grant for schools to funding for schools to bring in programmes for school improvement. And KiVa was one of the programmes that they included on their list. So obviously Judy got through to them, which was great. And we had Christina come over to do some training for us. So it was the first time that we'd used KiVa in Welsh schools. I'll talk a little bit about that project now. So it was a very small scale kind of pilot study done in the academic year 2012-2013. We had 17 schools in all that Christina trained for us. So there were 14 schools based here in Wales who accessed that programme through the School Improvement Grant. And we also had 3 Cheshire schools which were just very keen to try it out. So they paid from their own budgets to come onto the training. The training, following the training from Professor Salmivali, we had termly support meetings for the schools, and we collected some data before they did the training and a year afterwards using the KiVa online pupil survey, which asked questions around bullying perpetration, victimisation, and other things as well. We had some data from teachers as well, kind of midway through and at the end. And this is what we found. So in our schools who delivered this programme, we found reductions in both levels of victimisation and bullying perpetration for all of those 17 schools. So this got us quite excited, you know. When we spoke to the teachers, they were really enthusiastic about the programme, really positive about the lesson content and how it was structured. Later on, if you want to go to the back, there are examples of the KiVa manual. You know, everything is set out, all the lessons are set out. It gives the kind of activities that you can do. So teachers really loved that. They reported that pupils were really engaged with the lessons and really enthusiastic. By now, we hear teachers saying, you know, we have a new verb now. It's called KiVaing. You know, children are so excited. Oh, we're going to be KiVaing this week. So they were reporting positive impacts on things like child well-being, child behaviour, you know, more pro-social behaviour between peers, and just a nicer class atmosphere and a nicer playground atmosphere. We went back to these schools then the following year, and we did a 2-year follow-up, and we found that those changes had stayed. They'd maintained. So those schools that had started delivering KiVa in the year 2012-13 had continued to deliver, and those levels had continued to stay low. Around that time, we also had the translation of the first unit of KiVa as well, so for 7 to 9-year-olds. That then became available in English, which meant, you know, we could do some more research. So we went for some lottery funding, which we got in 2013-14, to do a much larger study than, well, no, a slightly larger study than the pilot study. I'll get to that in a second, but around the same time, you know, there were developments in terms of our affiliated charity, the Children's Early Intervention Trust, were awarded the UK dissemination licence for KiVa. So we are the only body in the UK that provides KiVa training. We continued to train schools around this time as well. So, following that small pilot with 17 schools, we wanted to do what we call a randomised controlled trial. So a randomised controlled trial is like the gold standard when it comes to looking at things like intervention effectiveness. So we did a small randomised controlled trial. So we only had 22 schools, which equated to around 3,200 pupils. And what we did was half of the schools delivered KiVa in the 2013-14 academic year, and half of the schools we called control schools. So these schools just continued with their usual practice, whatever that may have been. And we were interested in things like, we did the online survey again, so looking at bullying perpetration, victimisation, but we were also interested in how the schools were delivering the intervention. So we call this fidelity. So did they deliver it as it was meant to be delivered? So we asked teachers to complete teacher lesson records, and we went in to do some observations of some of the whole school components of KiVa. So these are things like displaying posters, doing big displays in the school, wearing the KiVa vests, things like that. Now, bear in mind that this was a very small randomised control trial. You'll realise why a little later on, 22 schools. We didn't find any significant effect at this point. So we started trying to figure out why that might be. And what we found, very similar to what Christina was saying earlier on this morning, is that implementation matters. So we had big variability in how these schools were delivering KiVa. Adherence seemed to be quite good. So for those teachers that completed the teacher lesson records, which we only got about 50% of, which is not a lot, but of those who'd completed them, you know, adherence was quite good. They were delivering as they were meant to be. They were delivering the activities, so that was good. But exposure was low. So we measured exposure as being the length of the lessons. So in the KiVa programme, there is a 90-minute lesson which is delivered every month. But here in the UK, what we tend to recommend schools do is to split that into two 45-minute lessons, so one delivered every fortnight. But when we looked at this for this particular study, we found that schools, many of the schools were not delivering 90 minutes worth of content every month. So exposure was quite low. There were also variabilities in terms of how schools were implementing the posters around the school, how many were wearing the vests. You know, it can be quite controversial for some teachers. I've talked to some teachers that say, yeah, they don't mind, they wear the vests all the time. And then other teachers like, oh no, it's like a target. I don't like wearing the vest. So, you know, it was very variable. The other thing that we found doing this project was there were very big differences between how we collected data in the intervention and the control schools. It wasn't exactly the same. So in the control schools, we gave them some guidance on how to do the online survey, but in the intervention schools, we did train them a bit more. So there were some differences with that as well, which may be why we didn't find any significant effects. So we knew we need to look at this in a bit more detail. So over the years, we've established more processes around how we train KiVa. We have our KiVa coordinator in the UK, which is Dr. Susan Clarkson. She is our main KiVa trainer. So we started looking at this implementation problem, if you like, and how we can start to think about supporting our schools. So a little later on, we continued to train schools who came on and were paying for KiVa training through their own kind of school budgets, because they could see that the international evidence was very good and our initial evidence was very good. So we did a study where we compared these schools. So we had 41 schools, this was in 2015, and you know, we see reductions here as well in both victimisation and bullying. So these were schools that signed up to do KiVa and went off and did it. And we still see reductions, even when there wasn't that researcher presence as we've seen with other research. These were just schools implementing. So we know it works. We then have continued to do some research around KiVa. We've done a little couple of smaller projects, but we knew that we needed to do a big project. So we started talking about getting some funding to do a much, much larger randomised controlled trial. So it took us about 2 years to write this grant application, which went to the NIHR, so the National Institute for Health Research, and we got the funding in 2019, and this was our Stand Together trial. By this point, the third unit of KiVa had also been translated, so we've started doing a bit of work with secondary schools, which you'll hear about later on this afternoon. But in terms of the Stand Together trial, this was a large multi-site trial. So we have schools, so we had 5 main partners, so Bangor University, Cardiff, Exeter, Oxford and Warwick. We had 4 main sites, so we had schools across North Wales, we had schools across the West Midlands, we had schools in south east of England and schools in the southwest of England. So a total of 118 schools. So you're talking about over 11,000 children was in this piece of research. Again, we did half were randomised to do KiVa and half continued to do their usual practice. So KiVa, so we got the funding in 2019. You all know what happened just after that. So we actually started collecting data in the kind of early 2020. I was actually in a school when we got the message of, we're going into lockdown. So we had to stop our data collection early. We fortunately were given an extension from the funders given the extreme circumstances. So we did our baseline data collection again in 2021. KiVa was delivered by the schools in the academic year 21-22, and then we collected our follow-up data in summer 2022. And these were the things that we were interested in. We asked pupils to report around bullying victimisation, bullying perpetration, well-being in school, empathy, the different roles around bullying. Teachers reported on pupils' behavioural, social and emotional skills, their own self-efficacy, their own well-being and levels of stress and burnout. We are just in the process of getting access to some administrative data, free school meal status, special educational needs, levels of absences and exclusions in the schools, and some details around Key Stage 2 attainment, although it's very variable given the COVID pandemic and everything. And we had some measures around implementation as well, so KiVa coordinators filled out a checklist and the team leads, and we did some work around the personal social health kind of curriculum, the PSE curriculum in schools, what they were already delivering. So unfortunately, we were really hoping that we could be able to talk to you about the findings today, but we're still waiting to hear back from the journal. So we really are hoping it's going to be very soon. So I don't have any updates on that. We do have other updates, so we are working with around several other papers in preparation. We had a very recent publication from our first baseline from Dr. Julia Badger. And we are preparing a lot of materials for schools. So we're in the midst of preparing videos for trial schools. We're going to be doing some results summaries. And we have some work behind the scenes as well. So my colleague, Dr. Anwen Jones, is doing a good practice guide. So this is where schools have told us the things that they're doing and the things that they like about KiVa. So we're putting that together, and we've established a network for our KiVa schools. So these are all the KiVa schools that are registered in the UK, are able to share, good practice ideas and, oh, I'm having a bit of trouble with this, well, how did you deal with it, that sort of thing. So all in all, this map is just showing us how many counties where we have trained KiVa schools. So we have KiVa schools in every county in Wales. We have KiVa schools in at least 20 counties across England. And we have some up in Scotland as well. And we had some over in Northern Ireland, although Northern Ireland now have their own KiVa network, KiVa dissemination licence. So we won't be pursuing Northern Ireland any further. So, we're getting there. We're really excited about KiVa, and we hope to be training more schools in the future. And there we go. Thank you very much.